The Dental Download Podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hello everyone, happy Monday. Welcome back to another episode. This week is a solo episode, just me, your host, Haley, and the topic is going to be getting ready for clinic, preparing for clinic, kind of how my school has trained us thus far as I'm finishing up my second year of dental school next month, and then I'm starting to see patients the first week of May. So I kind of wanted to reflect on some of the courses we've had, which ones were clinically relevant, which maybe not so much, and then how they've structured our preclinical hands-on training. Just kind of looking back on the things we've done up until this point. So if you're interested in dental school or you want to kind of compare and contrast my experience with yours, this might be an interesting episode to you. But before we get into that, I wanted to do a little catch up on this past week of school for me. So the most fun thing was, honestly, this weekend. I'm recording this on Sunday, March 27th. But Friday night, we had our ASDA gala, so it was called the Mandiball, so a ball gala, but like mandible, jawbone. So it was through ASDA, and it turned out pretty well. I think it's the first like big event and first gala that we've had in many, many years, so there was bound to be things that could be better, but I think overall everyone was happy they came out. It was fun to get dressed up, to get pictures, to see everybody together, but we definitely have things we want to do to make next year's even better. I didn't get to do too much gala-ing during it because I am president of our ASDA chapter this year. I was mostly got there early to set everything up. I had the help of a couple of the social chairs, my boyfriend, one of the social chair's boyfriends, and then our vice president came by a little bit into the setup process as well. So we had some help with that. We got everything set up. People started to arrive around 7:45 because the event started at 8. And I got there at 6 to start the setup. So I was there from 6 until it ended at midnight. But from about 7:30 until 9 p.m., I was running the check-in. And then from, not even 9 actually, till 10 p.m., it was like 9:50 that I decided I would stop the check-in. So then I had about an hour, because people left around 11:45, 11:50-ish, since I did say it ended at midnight. So I had about an hour to get pictures with everyone, socialize, dance, all the fun stuff, which was still really nice. I'm glad I got to have a bit of fun, and I know I'm a second year, about to be third year, but that means I have 2 galas left. So I wanted to make sure that everyone on board that put in all the effort to planning was still able to actually enjoy the night. So I appreciated everyone's help, but I also was trying to let other people have fun. So that's why I did the check-in for a while, and then we stayed till it was over and took down all the decorations, cleaned everything up, and then headed back home. But it was still really nice. It was just so fun to see everybody together. And then that day we also had our OSCE, which I'll talk about in this episode because it's like our exam to see if we're ready for clinic. And jumping way back to the beginning of that week, nothing too notable this week, I guess. It was busy, but it's like every week is busy in dental school. You've kind of gathered from my intros. I had normal class lectures, a call with a faculty advisor for one of my clubs. We had a quiz for diagnostic, which was actually the worst that I've done on one so far, and I'm pretty sure we get to drop one, so that will definitely be my dropped quiz. It was just a lot of content. Like there was 2 lectures instead of 1 on this quiz, so it was like 2 hours of content rather than 1 hour, and that definitely reflected in my score. And then I went to hang out with some girls in my class that evening, which was so fun. There was like 25 people there. We just all ate dinner together and then played some games. And I've been going to Barcode, which is a workout studio. It's a chain of studios, but they have one here in Ann Arbor. I've been loving that. So I went almost every day this week, as many classes as I could fit into my schedule. And Tuesday was really nice because I didn't have to go into school until the evening for a club meeting. I got to just do all my classes and interactions with people over Zoom other than going to the workout class in the morning. And then on Wednesday, we had another practical in SimLab. We had to do a bridge prep. So now in lab, we're working on provisional or temporary bridges, which is a lot harder than temporary crowns. It requires like triple the amount of time to trim it down and make it look right. So that's something I'm working on. We had a lot of as the things in the evening. I know I mentioned the gala, but we also had a lunch and learn with Philips Sonicare for the D3s and D4s to get toothbrushes. We had the D1s Oral-B lunch and learn. We had a social with another DSO at Pizza House, which was really tasty and fun. And then on Thursday, we had an executive committee meeting for like all 36 people that are involved in different committees in ASDA. And then it was Friday with the OSCE and the gala. So that kind of catches you up to now. The weekend was really fun. I just spent it with Justin visiting because of the gala, and then Saturday we were with my family for like half the day, and then his family for half the day, and then today on Sunday I got to go to another bar class, and we did grocery shopping, church, hung out a lot, like much more of a relaxing day, and then in the evening now I've just been getting some school stuff done and this podcast, so pretty much just a few hours before you're all listening to this because it's Sunday night and you can listen as early as 5 a.m. Eastern Standard Time every Monday morning. If you didn't know, that's when these episodes go up. So that's our recap for the week. So let's get into the episode about preparing for clinic. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode, so I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. Okay, jumping right in, just to give you an overview of the topics I wanted to talk about today that I thought would be possibly interesting, how we are prepared for clinic at Michigan. So first, I'm going to read through all the classes that we've taken that are clinically relevant. I might give some tidbits about them if anything comes to mind. And then I'm going to talk about what we learned and practiced in restorative sim lab, what we practiced in complete dentures and removable partial dentures, what we did with Perio, so like our prophies, and then what we did with the OSCE this past Friday. And then I'll finish up with as much as I understand about what they expect of us this summer and what I'm planning to do over break to be ready to start bringing in patients come the very first week of May. So as I mentioned, we're going to start with classes, so I'm just going to look over my transcript here and let you know what classes I think were relevant to like each patient appointment. Obviously, all of the body systems and everything, depending on patients' health conditions, it would be more relevant to certain people than other people, or it'd be really helpful for medical emergencies or just understanding how the body works in unique situations, but I'm talking like basic appointments. So our first semester of D1 year, I would say the only thing that was really useful would be dental head and neck anatomy, because with your intra and extraoral exams, especially your extraoral exams, you're feeling along the sternocleidomastoid and the masseters and lymph nodes all along the neck and behind the ears and everything. So you definitely need to understand your anatomy. But I think we had, it looks like 8 or 9 classes that semester. That's the only one that I feel like we use all the time with patients. Fall of my first year, I'm again just eyeballing how many classes there were, maybe like 13. And I would say all of our behavioral sciences, we have them pretty much every semester. They're actually very relevant for how you communicate with patients, showing empathy with patients, making patients comfortable, helping them understand the treatment plans, helping them actually have efficacy when it comes to their oral hygiene. If you're giving them oral hygiene instructions, how to improve at home, like how to communicate that well with them to make them actually understand the need for it. And then we also talk about all different kinds of patient backgrounds, different mental struggles that people might be going through that could affect their dental care. And I feel like that's very common. There's certain other health conditions too, like I said, like maybe diabetes or hypertension that a lot of patients are on. So that is pretty day-to-day care. But anyways, for the mental health and the patient communication, we learn about that in all the behavioral science classes. And that's when we had our first one, was our D1 fall. And dental anatomy and occlusion is very, very relevant for your actual skills that you're doing. Having a proper occlusion is key to restorative success. One of the keys to have the patients not be in pain, to have things look and function properly. And then I would say Cardiology 1 was also very clinically relevant and is also great for patient education, how we're going to explain to the patients why what we're telling them is true, why it matters, what's the background on it, scientifically, clinically, how can we tell them that brushing your teeth actually matters? Like, what's the answer? That's something we learned in that class. And then for winter of D1 year, so our last semester of D1 year, pharmacology I think is really clinically relevant, but unfortunately I don't think I took that much away from it. Like, I knew things in the moment when we were learning them, but there's a lot of stuff I don't know right now that I'm hoping, as I keep seeing more and more drugs come up that are for common conditions. Like I said, like I understand certain things that I see often, but there's still plenty of drugs out there that I would like to just look at and know rather than have to look it up really quick, which you're allowed to look things up when you see patients, and you should, because you have to fill out their health history form and write the significance to dentistry that specific drug is. And then radiology, that was our first semester taking radiology. So that's also very common. We're not allowed to treat patients without dental radiographs, up-to-date dental radiographs. So starting to learn how to take them, what are the principles that you're looking at, what do radiographic errors look like, and how do you correct them. And then another behavioral science class, and then another cardiology class. And then we also had our first Perio class. That was fundamentals of periodontics. And that was when we learned all of the different scalars and curettes and perio probing and explorers and just how to use them to assess patients' periodontal health, which is like the first step of treatment for patients, is to get their perio in check. In all of those semesters, we also had sim lab, but I'm not even talking about that yet because that's going to kind of be a separate topic, like I mentioned in the beginning when I gave you a little outline. So cruising along, we're already into my D2 year. So first semester is a D2. We had another pharmacology class, which was structured pretty much the same as the first one. So I, once again, understood things in the moment, but there's a lot I don't remember, which is unfortunate to me. But it is important because patients, when they show up, are on all kinds of drugs for all kinds of different situations. So, and then we also had treatment planning, which again is like pretty key to, you can't really bring a patient in and treat them without having your treatment plan thought out and discussed with faculty and put into the computer and everything. And then we had Periodontology 1, just following up on more perio. Then we had periodontics. And then we had restorative, which is like lecture portion of sim lab. We had another behavioral science class. And we also had our first class that would lay the foundation for like oral lesions. It's probably the best way to explain it to my listeners. It was called neoplasia. So being able to notice what's not normal in the mouth and come up with differential diagnoses for what it could be, and understanding if that needs to be biopsied or not, if it's going to go away on its own, what kind of product should we be prescribing, if anything. And then for D2 fall, so last semester, we had another perio class. Like D2 year, most of these classes are clinically relevant, which is super cool. So I'm probably going to read off almost all of them. But we had a periodontology 2 class. We had our first endodontics class. We had another periodontics class, another restorative lecture. We had a diagnostic sciences 2, which was following up on radiology, so diagnosing lesions, looking at x-rays, which is really, really useful because you had to understand what was normal anatomy versus abnormal anatomy and being able to analyze what was maybe going on, what was causing it, and what kind of further referral or treatment do we need to do. And every single time, like I said, you need to have radiographs to be able to treat patients at our school. And every single time you take a radiograph, you need to go through a systemic approach of analyzing it, looking at every single feature and making sure that it looks healthy and normal. And then we also had removable pros, so that was the complete denture lab, so that I will talk about in a little bit as well. We had another Perio class, so 3 Perio classes in one semester. And then we also had ortho. Ortho was one of my favorite classes. It was very well structured. I think I talked about it in probably like the mid-semester catch-up of my fall semester and also the summary episodes. You can listen to either of those if you want to know more. I did that every single semester of dental school, by the way. So if you want to know like D2 fall, just search that. Or if you want to know D1 summer, like my first semester, just search that and you should be able to see like a recap of how everything went, how exams went, how my grades turned out, highs, lows, all of that. So that might be interesting to you if you're intrigued by the topics of this episode. And then the semester that we're in right now, my D2 winter, last semester of my D2 year, we have occlusion fundamentals, which is really nice. We had a lab to talk about temporomandibular joint disorder and how we can try to diagnose that. We also talked about sleep apnea. We can't diagnose that, but we can notice it and give patients referrals for sleep studies and to see their physician. And then we also have oral surgery. We have another restorative lecture. We have medically compromised patients. We have oral medicine radiology. We have another diagnostic sciences class, but this one is more about oral lesions, like visually, clinically seeing them again. And then we have, what else? Another ortho class. We have pediatric dentistry. We have another perio class. We have another restorative lecture. And then we also have our first like dental business class. So those are the ones that are pretty clinically relevant, which is actually like every single class that we're in. So I just pretty much read off the whole thing other than our labs. So that is telling you that as time progresses, you get more and more into completely clinically relevant curriculum, which I think is very key, and I'm appreciative of that for sure. And the next thing that I wanted to talk about was what we've learned throughout all of our sim lab sessions, and then also through our ACE clinic rotations. That's the easiest thing for me to sum them up as, but ACE is just a specific building lecture hall name for our school, so that won't really mean anything if you go to another school. It's Advanced Clinical Education Lab, ACE. So in there, I guess I'll just start with that and then I'll go back to what we did in sim lab. But that's where we practice things on each other. So we had one semester of radiology on the Dexter mannequin in there, and then after that we did all of our D2 year and our, I believe, D1 winter. So I think we've done 4 semesters of radiology rotation up in clinic, taking x-rays on patients. And also in ACE, we did our Perio lab and rotation and everything. So we did basically one session on a Perio typodont, and then we would do one session of the same type of thing, whether it was sickle scalers or curettes or Perio charting. We would do that on our classmates. So we would practice once and then come back in a week or two whenever we were scheduled and work on our classmates. So that was how we did Perio. And then we also had a handful of other rotations in there, like oral medicine, the occlusion one, which I talked about, like TMD assessments, TMD, so that's the temporal mandibular joint disorder, and then like occlusion labs, and we did 2 sessions of anesthesia lab, so stab lab, where we give each other the numbing injections. We also did the like blood glucose testing. We did some like in case of emergencies, you would do this type of training. Way at the beginning, we did like the basics before you started assisting, like how to set up a cubicle, how to like don and doff your PPE, how to clean everything correctly. So before you started assisting in clinic, we did that. And I think that's most of the rotations that we've done in ACE lab. And then I guess I also mentioned clinic, so I can talk about that too. I think that's the biggest reason I feel like ready to go to start in clinic is just because I've spent so much time in the D3, D4 clinic assisting because we're required to, not just me being a go-getter, but like we're required to. I did a little bit more than we're required to, but not a ton more than we're required to. But I still feel like I am familiar with some faculty. And the biggest thing is I feel comfortable because I know a decent amount of third years, and unfortunately the fourth years are all graduating. But I feel like I know enough students and my own classmates that I will have people to assist me, to kind of help me. And I've just seen how the faculty really do a great job of like instructing you, but not just telling you how to do it or not doing it for you. Like they give you probing questions so you can kind of think through the solution on your own, but you can always phrase something like, oh, do you like to do this way? Or what is your preference for something like this? Is a nice way to phrase something so the patient doesn't get freaked out, but that's kind of your way to tell the faculty, like, I don't actually know the right way to go about this. That's, I think, one of the biggest reasons, though, that I feel comfortable starting in clinic. I know that I'm obviously going to have a lot of things I don't know or a lot of things I have questions about, of course, but I just feel like I've done enough on these typodonts. I'm ready to work with patients. I love getting to have conversations with patients when I'm assisting. It's just way more like engaging and makes me more excited, and I leave in a better mood than if I just like go drill for hours and hours on a typodont. So I'm just really looking forward to clinic, and I think assisting is one of the big reasons that I feel ready and not as overwhelmed. I think, again, I'm not trying to sound naive. Like I know it's going to be a big adjustment and I'm going to have problems, but I don't feel like I am going in with no knowledge. Like I definitely feel prepared to be at the stage that I'm at. And back to what I was going to talk about was the sim lab part. So we had what I always call sim lab, and then we have RPD, removable partial denture, and complete denture. So when I say sim lab, it's like restorative. So our first year was all preps and restoration, so class 1 through class 5, and we did a little bit of amalgam, even though you don't usually do that in clinic. We also tried doing GI, so we know what that's like the RMGI, I guess, is the correct word for that. And then our D2 year has been all crown preps, bridge preps, temporary restorations. Then we also got to do a lot with the scanning system and CEREC and crown design, and we were able to design a crown and get it fabricated in the lab, like milled out, and see how nicely that fits, which was really cool. We did a lot of like diagnostic mounting. Oh, we also had an ACE lab about that. Lots of like impressions and mounting on your articulators and everything with our classmates' impressions, and also just with like impressions of our typodonts. So I definitely feel a lot more familiar with that. I really didn't even know how to pour up an impression well or any idea how to mount. I'm still not that confident with like a face bow transfer, but again, more confident than I was at the beginning of this year. So that's something. I'm sure when I do it on like 2 more patients, I'm going to feel good about it. That's just the thing. Like it just takes a few attempts at something to feel like, okay, like I can manage my way through this. And you still have to get checked so often through like all these little steps. So it's hard to mess something up in a way that's irreversible. Like they don't really let that happen with the way that the checks are required in clinic. So you don't need to be too worried because you're already going to be pretty conservative and go slow with things, not overdo anything, because you can't get tooth structure back once you get rid of it, and everyone knows that. So I don't think that there's going to be too many really, really bad situations happening. I think everything will just be more like a situation that I might have to call over faculty to work through something that maybe I couldn't finish properly, or I might need them to help me adjust something. But I think that the way the systems are set up, it does avoid big issues, which is obviously important because we're working with real people. And then we had, besides restorative, we have dentures. So our first semester of that was D2 fall, which was last semester. So we did complete dentures, basically like a case all the way through as much as you can without a real patient. So we couldn't actually border mold, which was frustrating because I'm still not like that confident in it because I've never done it. I assisted a border molding appointment once, but it was before I really knew what it was. So I was also kind of lost. Like if I assisted one now, I think I would gain a lot more from it because I would be trying to like quiz myself as we went through it. But we did as many of the steps as we could. It was just confusing because you weren't with a real patient. So you'd sometimes skip steps or do steps out of order of what you would do for a normal process of making a denture. And then I just really disliked having to like set the denture teeth myself in the wax rims. That was just not enjoyable. But I got through the class. And then this semester we worked on removable partial dentures. So that means the patient has some teeth left, but not all their teeth. So then you have to design different metal frameworks to accommodate whatever teeth that patient wants replaced. And that's been a little bit better. It's a lot more challenging in the sense that there's a bunch of different ways you could do it versus complete denture. Like there's a right way and there's a wrong way. With RPD, there's definitely a lot of wrong ways, but there's also multiple right answers, which is good and bad. Like sometimes that can be confusing because you might be comparing with a friend and you have different ideas, but they could still both be right technically. But usually there is like a better answer, which I appreciate. Like I like to just know like, okay, what's the right way to do it so I can try to learn that and replicate it. But it's not so simple because everyone's mouths and bone that they have left and like how deep their vestibules are and the inclination of their teeth, which teeth they have left, how their occlusion is, like all that's different. And when they have teeth remaining, you have to work with the teeth that they have. And that's why all these cases are so different. And I'm dreading, but also excited for when I get my first denture cases in clinic because I just have not enjoyed it in the sim lab portion, and it's definitely challenging, so that's why I'm dreading it. But I'm looking forward to it because I know once I get through one or maybe two, it's going to make a lot more sense, and I won't be dreading it so much. I might not enjoy it. It might not be what I want to focus my general dentistry practice on one day. I would be very surprised, but hopefully I feel confident enough to keep doing them during dental school is my point. Because we have to. I don't really get a choice with that. And our last topic of this episode is how they're assessing if we're ready for clinic. So first things first, I mentioned all those sim lab classes, so restorative, crown and bridge, dentures, like passing those in your practicals and your exams is obviously part of showing that you're ready for clinic, and then passing and not being on like probation or anything with all your lecture classes up until this point is obviously part of being ready for clinic. But they also have this exam called an OSCE, so that's an abbreviation, it's OSCE. And for us, it's actually not any clinical skills because our practicals are kind of assessing that as we go through first and second year, but it's a written exam. It was 5 sections. So the first was Perio, and then we had prosthodontics, we had restorative, we had treatment planning, and then we had a Zoom, which is our standardized patient interaction. We have several of those per semester, so it's basically a patient actor, and then you have a different scenario. So we've done some on smoking cessation, on just reviewing a health history, treatment planning. We've done some with like endodontic pain. We've done some with obstructive sleep apnea. We're about to do one between our classmates, so not with an actor, but about a patient having like bulimia, or a child with like high caries risks, which is a chance for you to practice how you would have a dialogue with a patient regarding these situations and like questions a patient might ask, how to be able to respond to them, whether they're more typical or whether they're more aggressive or whether they're not being compliant with your treatment options. So those are actually really useful. They're kind of annoying in the moment, but like looking back, they're only helping. Like they're not actually as annoying as they might feel day of when you're like waiting to get let into the Zoom room and you're like nervous to meet with this fake patient. But all in all, like I would rather have that conversation in a setting where it doesn't matter if I do bad than with a real patient. So I'm glad that I had those experiences. But we had one for the OSCE as well, and then we had like a little reflection, a couple questions about it. And that was that. It was on Friday. I don't know if I passed all of them yet. Like I know most of my scores for the ones that were multiple choice, and some of the sections had short answer questions, like 5 short answer questions. So those aren't graded yet. And then apparently like you could get like 7 out of 8 correct, but still have to remediate if the one you missed is like a really important flagged question where you would be not safe to be with patients, basically. So if you get those wrong, you just meet with the faculty and they go through the exam with you and make sure that you fully understand everything you got wrong. That way you're safe to be with patients. So that was the OSCE. Since we took it on Friday, I don't have my results back yet, but I mean, I felt fine about it. I wouldn't be surprised if there was like 1 or 2 concepts I was fuzzy on. Like I would rather meet with this faculty and discuss it than not be clear when I'm with patients. And last thing I wanted to talk about is as much as I know so far about what they expect of us this summer. So I know that we have an orientation to clinic that Monday, the first Monday of May, but they want us to have patients scheduled that week. So my understanding is that they're going to start adding patients to our like scheduling system all throughout April as the D4s are meeting with their patient care provider person. It's called like a PCC, patient care coordinator. That's what it stands for. So they're people that work for the school that manage the different clinics, and the D4s meet with them and say, oh, this case is pretty complex. It should go to an incoming 4th year in my vertical team. This case, they would do better with the incoming D3, and then I get assigned patients as that goes. And apparently then I'm supposed to be scheduling them and bringing them in for exams or whatever their current treatment needs are during my April break. That way they're scheduled starting that first week of May, second week of May, and I have some appointments to go on. I don't know how many appointments we're going to get. It's hard to compare because they changed the clinic schedule where there's 3 appointments a day instead of 2. But they also had clinics closed for construction and for like social distancing and things back when my roommates were starting their 3rd year. So I don't know how many appointments we're going to be able to do per week. I would think maybe like 3 or 4, given that we are scheduled for like 2.5, I would say, academic days in the summer. We already got our class schedule, and then the other days of the week of the 5, we can be scheduling patients. So I would think we can schedule like 3 or 4 a week, but I don't know yet. That's why you guys got to keep tuning into the podcast every week to see. And that kind of already answered the last thing I mentioned in the outline, just like what I'm planning over break, basically going through our scheduling system, seeing my patients on there and trying to get some people scheduled before break, before my D4 vertical graduates. I'm hoping to do a phone call with her or meet her for coffee or something just to go over the patients that she is passing down to me. Maybe we can even have the current D3 come. So it'd be me, D2, D3, D4. We can maybe all meet up and just discuss the patients, because maybe eventually she's giving some of the harder cases to the current D3 that's rising. But when that person graduates, maybe their care is still not done, and then they'll get passed down to me still. Basically, I just want to meet with my vertical team and get background info on the patients I'm going to be getting. That way I can be as prepared for them and do my research ahead of time and make sure that I have all my options ready to present to them so that I can seem and be prepared when I'm communicating with the patient, communicating with the faculty, and just do the best care that I can, because I mean, don't we all want to do as good as possible for our patients and be competent, but even be better than that is really the goal. So that's probably what I'll end this episode on, just because I don't know too many specifics about what's going to be going on this summer, but that is why you'll have to tune into future episodes every Monday morning. Thank you so much for listening this week. Next week, we'll be back with another guest, so I will talk to you then.